Hello, my name is Jeremy Carroll. I'm a registered nurse, and today I will be performing a final exam head-to-toe assessment video with my patient, Tiffany Carroll, with consent. This is for Ohio Christian University, the Health Assessment and Genetics NR 3400 class with Professor Baker. And I would first let you know that I have washed my hands and we're prepared to start. Today, Tiffany, we're going to be doing a head-to-toe assessment. Is that going to be okay? We'll do some different things and we'll work through to check you all over. The first thing that I would do would be to collect subjective data, history and physical, family history, explain the fact that we're conducting the head to toe, and definitely I want you to let me know if there's any pain or discomfort with any of the examination, so that way we can either alter or change and we can make sure we record those issues. I also want to make sure that you know, because I may not state it all the way through, that with each body system we will be continuously checking the skin throughout the exam, color, turgor, temperature, and just to make sure that everything is intact all the way through. We'll first start with an assessment of the speech and language rate, as well as orientation. Can you tell me your name?
Tiffany.
What's today's date?
February 23rd.
Good.
2015.
And who is the president?
Obama.
Good. Good. How's your sense of smell doing?
Good.
Good. For the first cranial nerve is the olfactory nerve, and we wouldn't necessarily do a cranial nerve test for that unless the patient had some kind of issue with their sense of smell or taste. So the next thing we're going to go to is the inspection of the head. I'll be looking first for symmetry, feeling temperature, feeling through the hair and looking at the face, looking for masses, lesions. We make sure to palpate for that. Of course, if you found any lesions, you will want to don your personal protective equipment, at least gloves and maybe other equipment depending on what you found. This is also a perfect time to be discussing hygiene if it's needed, because you're definitely checking those areas for the patient, and you could do some teaching at that point. Moving on, we would be moving on around symmetry of the face, color. Next, we're going to palpate the sinuses, so we would go with the frontal sinuses, a little pressure. Any pain there?
Yeah.
Maxillary sinuses, any pain there?
Yeah.
Occipital, any pain there? No, good. This is another time where I like to teach the ABCDE of skin assessment for self-assessment. The A stands for asymmetry, and we're talking about moles or lesions or any discolored areas of the skin. Looking for asymmetry, which is the A. B is the borders, looking for round versus that asymmetrical edge, and also a dark edge versus light. The color, and especially if there's any color changes. The diameter, if it were increasing, and of course elevation or enlargement of the area that you're viewing. Next, we're going to check cranial nerve number 2, which is the optic nerve. And of course, we're going to do, to start off with, I would want to check the sclera, looking for a white color. Can you open real good? There you go. Checking also the conjunctiva, looking for pink and moist. Good job. I would want to go ahead and check her pupils at this point. So using my light source, let me get it straightened out here. There we go. Okay. Look directly at me. Good. Looking for that pupillary reaction. Good. And we're going to check peripheral vision as well as the 6 cardinal views. This involves the optic cranial nerve as well as the oculomotor, trochlear, and abducens, which is 3, 4, and 6. I'd like you to cover your right eye for me. I'm going to have you cover it actually with your hand. Sorry, that's okay. And then I'm going to cover. I want you to stare at the wall beyond me. Don't try and look or move with the card, okay? Good. Good. Go ahead and switch. Good. Good. All right, we have a good pupillary reaction there. Next, I want you to stare right into my eyes, and I want you to tell me, don't look off to the sides of it. Tell me when you see my fingers.
Okay.
Good.
Okay.
Good.
Okay.
Good. Okay. Peripheral vision is intact, as well as no convergence or nystagmus. One more thing we're going to check here. I'm going to have you stare directly at my pen, and now what I want you to do is just keep your eyes on it. Good. Good. Convergence is good. Next, we're going to check the trigeminal nerve, which is cranial nerve number 5. Have you clench your teeth? Bite. Good. And close your eyes for me. We'll get our little Q-tip here, and I want you to tell me when you feel me touch and where you feel me touch.
Right cheek.
Good.
Left jaw. Left forehead. Right forehead. Left cheek. Right jaw.
Perfect. So the trigeminal nerve is intact. Next, we're going to be moving on to cranial nerve number 7, which is the facial nerve. Can you raise both eyebrows for me? Perfect. You poof out your cheeks like you're going to blow out a candle. Perfect. Next, we would move on to our fundoscopic examination of the eye. So I'm going to get my ophthalmoscope, and starting on 0 here. Basically, for technique, you would want to hold for left eye, holding left hand using my left eye. I'm going to use my right hand, or the non-controlling hand, for the ophthalmoscope to control the forehead and touch right at the eyebrow. It keeps me from bumping into her eye, as well as using my pinky on the controlling hand to make sure that I don't get too close to the face, because this is a 1 to 2 inch examination. So I'm going to turn my light source down and find the retina there. We'll move slowly in. Good. Good. We'd be doing that examination actually for both sides of the head, using the diopter to adjust for clarity, and I'm checking the vessels, the retina, the macula, and the optic disc. Next, we would be looking at cranial nerve number 8, which is the vestibulocochlear, and we're going to do the whisper test for that. So coming here behind you, I want you to speak out the word that you hear me whisper.
29.
Good.
49.
Perfect. So that cranial nerve is intact. Next, we're going to move on to around the sides of the head and face, where we're going to check out the ears. We're looking for piercings, also any abnormalities, lesions, anything like that. I'm going to feel along the pinna and the auricle area. Good. And then give it the tug test, which is pulling back. Any pain when I do that?
No.
Okay, perfect. Next, we're going to be moving on to our otoscope examination, where we'll be viewing the canals and going on from there. So let's take a quick peek. Now, with this hold, my left hand to left ear, again, it's the same as with the eyes. I like to use a pencil grip, again, using my pinky as my guide with the cheek, using my non-controlling hand to grab a hold of the pinna of the ear, and we're going to go up and out with that. First, I start at the outside edge, looking at the canal, and then going into the ear until I view the tympanic membrane. Perfect. Looking at the tympanic membrane, it should be a white and reflective color. We're going to be able to see the handle of the malleus, light reflex, pars tensa, and pars flaccida with that. This is also a time when we could use a tuning fork if we needed to check hearing, and again, we would be doing this examination on both sides. Moving on down through, let me change out my scope here, and checking the nose for symmetry, looking if there's any closed area or deviations or anything like that externally, any abnormal drainage, and then of course we're going to check the turbinates, the mucosa, and checking for polyps and also deviated septum. So again, my right hand is my control. I'm using my pencil grip, thumb to the tip of the nose. We're going to take a quick little peek. Good. Other side. Perfect. Good job. Again, looking for drainage or any other kind of issue would be something that we would want to chart with that. Next, inspecting the lips and the lower portion of the face for cracks and lesions. Next, we're going to want to work on our cranial nerves 9 and 10, the glossopharyngeal and vagus nerve, by inspecting the tongue and the palate and dentation, as well as mucosa and masses with our pen light here, if I can get it going here. There we go. Just get my light source and go ahead and open your mouth for me, if you can. Good, checking on that. Now, can you stick out your tongue and say ah real long? One more. Perfect. Looking for with the ah sound, looking for the uvula to rise with that. Moving on down for spinal accessory, we're going to check cranial nerve number 11. And can you turn your head to the right, and then to the left, all the way back, chin to chest. Perfect. Now back up here, and I'm going to put my hand up. I want you to push. Give me resistance against it. Good. Resistance against it. Good. Resistance against the back. Good. And forward. Good. Excellent. And then also, I missed one here. We need to do a shoulder shrug. Push up against my hands. There you go. Good job. Next, we'll be looking at the neck, front and back, looking for symmetry of the skin, and again, feeling there. And I'm going to do a frontal approach for a thyroid examination, checking for nodules or lumps or anything abnormal or any pain there. Good. Also checking for goiter. The next thing we're going to do is to move on to our lung and chest examination. First, I'll be taking a side view, looking at the AP angle 2 to 1. She's perfect with that. I'm going to go ahead and have you, actually, you can stay right where you're at. Sorry, I lost my place. So we're going to start with palpating the back for primitives. So when I put my hand in, I'm going to have you say 99.
99.
Good. A little louder.
99.
Good.
99.
Good.
99.
Good. Feeling for that vibration. Good.
99.
Keep going.
99.
2 more.
99.
Good.
99.
Good job. Next, we're going to move on to, well, at this point, excuse me, you could check for sacral edema as well as perispinal tenderness. Any pain down here, and there's no swelling. Good. We're going to percuss. So starting at the top and working my way down, I'm listening for my percussion sounds between the vertebrae every other. Good job. And now we're going to check for diaphragmatic excursion. So I'm going to get my ruler. Go ahead and take a deep breath in and blow it all the way out. And then hold. Good. Go ahead and take another deep breath in. Hold. Good job. Let's measure that one here for you. Good. You're right at about 4 centimeters. 3 to 5 centimeters is normal. You can continue to breathe normally. That's a normal range for the diaphragmatic excursion, so everything's normal with that. Next, we're going to check the costovertebral angle, and we'll place the non-dominant hand right below where the rib cage is here, and give it a little strike with the bottom owner side of the palm. Any pain? Any pain? Good. That could show a sign of kidney infection or other issues separate from the lungs, but while you're back there, we're checking that. Then we're going to move to auscultation of the back. Maybe take breaths each time I move. Good. 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 Now I want you to say E for me. Hold it.
E.
Good.
E.
Good.
E.
Good.
E. E.
Almost there.
E.
2 more.
E. E.
Good. By having the patient say E, and checking the back is checking for consolidations. If the E started to sound like an A, it could be a sign that there's a consolidated area in the lung, which should be able to pass that E sound through. I'm going to go ahead and have you lay back and turn here for me. So next, moving on with our inspection of the front of the chest, we would be checking the skin and checking for, again, lesions, masses, anything going on with the skin, as well as palpating. And what I'd be palpating for is the pericardial area here, feeling for the carotid pulse. So I would also be looking to check at a 45-degree angle that there's no jugular venous distension. Good. Her jugulars are flat at 45 degrees. Checking the carotid pulse. Good. We're going to go ahead and check the brachial pulses while we're here. Good. We'll go ahead and do a quick little percussion on this side. Good. Good. Checking those lung fields, making sure that there's nothing consolidated. Next, we're going to check out the air movement. We're going to want to avoid the breast tissue in the front because it will diffuse the sound. Take a breath for me. Good. 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 Good breath. Good breath. Moving right on from there, we're going to want to move into our cardiac assessment. We've already palpated where our pericardial area is, so I'm going to move right into listening with the diaphragm side first into the 5 areas. I'm listening for regularity, clicks, rubs, gallops. You can put them on. Good. And then when I get to the apical, I like to check the radial pulses with that, making sure what I hear and what I feel match. Good. I'm going to immediately switch over to the bell side and listen to the same spots again, listening a little bit deeper for those rubs and gallops. Good. Good. Over that apical area. And have you roll towards me and kind of lean forward a little bit, checking the apex for murmurs. Perfect. Excellent. Next, we're going to move on to the abdomen, genitourinary, and breast exam area. With this, we're just going to talk through the assessment real quick if we can. Of course, with the abdomen, you start with an inspection of the skin, looking for bulges, ecchymotic areas, any abnormals. Auscultation is for all 4 quadrants. Using the grid to auscultate 9 sections of the abdomen in just below the diaphragm area. And then you'd want to switch over to the bell to listen for bruits around the aorta, which is typically just to the left of center and above the umbilicus area. Listening to the aorta, listening to the renal arteries, listening to the iliac arteries, and then also the femoral arteries as well. You would want to palpate first light and then deep again, following that 9-place pattern, and also palpating the liver, the spleen, the kidneys, looking for rebound tenderness, using the hooking technique with the liver, and then also palpating the pelvic and suprapubic areas as well. Moving on from there with the liver span, you would be going down mid-clavicular first, 4th or 5th intercostal space. You would start using your percussion technique and finding the top and then also the bottom area, and then also finding mid-sternal. And with the mid-clavicular, it should be 6 to 12 centimeters is normal, and with the mid-sternal, 4 to 8 centimeters for that dull sound with percussion should be the normal. For the GU inspection for men, you're looking for bulges, scars, especially checking the inguinal area for hernias or bulges or lumps there, checking the skin and the hair, and checking for infestations. You would want to make sure that you're palpating the scrotal and penile area for abnormalities, as well as tendinous lumps or masses. For the female inspection for the GU, you're definitely looking for broken skin, rashes, lesions, growths, any other kind of skin anomalies, as well as the hair pattern and infestations as well. And also with females, you would want to note if there was any discharge, and if there was, the color and odor of that. Then with the breast examination, you would have to inspect the skin. You're looking for rashes, lesions, masses, again, checking the nipples and the areola for size and position, as well as symmetry. There are several different positions: lying, sitting, arms up, hands at hips, to check for the symmetry of that location. And then, of course, palpation clockwise, feeling in a circular motion, in to out or out to in, either way is acceptable, feeling for masses, and then also following the breast line up to the axilla, looking for tenderness or any lymphadenopathy. Again, being in the abdomen area, you'd be checking the femoral pulses, and then we're going to check the range of motion for the hips. So Tiffany, if I can have you uncross your legs here for me. I'm going to grab one leg here and just relax it in my hand. I'm going to go straight up, and then I'm working out to the side, checking the range of motion. Any pain there? And up and out. Good. With the musculoskeletal system, we would want to make sure we were checking all of the joints, looking for symmetry or abnormality. If you want to go ahead and sit up here on the edge for me, if you can. Okay. You go ahead and let your legs hang off the side. Can you, with your arms, can you bring your shoulders up and around, and then back down the center? Perfect. And then I would like you to put them hand in hand behind the back. Good. And then hand in hand behind the head with your elbows out. Perfect. And if you put your arms straight out in front for me. And first I want you to up and then down. Good. Make fists. Perfect. Now I want you to push up. Good. Push down. Now put your hands thumb up, Perfect. Push out. Good. Push in. Perfect. Bend your arms at the elbows. Don't let me pull them down. Don't let me push them up. Perfect. Again, checking for the musculoskeletal system as far as their ability to resist. Now, after the fist here, I would like you to grab a hold of my fingers, give me a quick squeeze. Perfect. Looking for symmetry with that. Can I have your fingers here? We'll check capillary fill on several fingers of each hand. We would want to make sure we did that at the foot as well, making sure that there's good circulation. And can you put your thumbs together here for me? Good. The angle was about 15 degrees, so no clubbing present. Next, we're going to check the legs. You want to make sure, go ahead and uncross for me, that you stand up to the side so that you, if they're really strong, you don't get kicked. And we're going to squat down and have you push out with your leg. Good. Pull in with your leg. Perfect. Push out with this one. Pull in. Good. And while I'm down here, I would also push in. Good. Push out. Checking also the dorsalis pedis and the posterior tibialis, and also checking for ankle edema or foot edema as well. Go ahead and have you stand up for me. First, making sure your patient is stable, but once you've figured out that they are stable, we're going to do the Romberg test to check for cerebellar function. So with your feet together, I'd like your arms out, your palms up. Perfect. And can you close your eyes for me? You want to stay close. You're looking for drift in the face or in the arms for at least 20 seconds. Good. That's been long enough. Good. Not quite 20 seconds, but that's the typical would be for 20 full seconds. The next thing I want you to do is arms outside, feet still together like this, and then after I have you close your eyes, I'm going to have you take index fingers, touch your nose. So go ahead and close your eyes. Right hand, touch nose, back out. Good. Left hand, touch nose, back out. Perfect. Good job. You can open your eyes. Now, I would like you to start on this side of the room, and I would like you to walk heel to toe like you're walking on a tight wire towards me. Perfect. And you can turn around if you walk on your tiptoes, going back to the other side of the room. And walk back to me on your heels. Perfect. That's good. You can stand right here in the middle. And I want you to flex back, checking the range of motion in the hips, side, and the other side, and to the front. And go ahead and bend down there for me all the way down. I'm checking for symmetry down the spine, checking down the spine, making sure there's no abnormalities, growth spine, any pain or anything like that. Back up here for me. You can come back up. And one more time, hands on your hips here for me. The one that we missed here was the twist elbow in, good, and twist the other elbow in. Perfect. Everything looks great. The assessment was a complete success, and I thank you for your time, and I hope that you all have a great day.